This video is for general information only and is not a substitute for personalised medical advice. Always speak to your GP or a registered dietitian before making significant changes to your diet. Is cutting calories aggressively actually dangerous, or is that just a myth? It's a real concern, and understanding where the line is between a safe deficit and a harmful one could genuinely protect your health. Here's why this matters. When we talk about losing weight, the conversation often focuses on how much, but rarely on how fast or how safely. Cutting calories too severely can cause serious harm, even when your intentions are good. So let's break it down. A calorie deficit simply means you're consuming less energy than your body uses. That gap prompts your body to draw on stored fat for fuel, which is the basis of weight loss. But the size of that gap matters enormously. NHS and NICE guidance recommends a deficit of around 500 to 600 kilocalories per day for most adults. That typically produces gradual, sustainable weight loss over time. And it's considered the evidence-based standard appropriate for most people. What's considered aggressive? Informally, that tends to mean cutting 1,000 kilocalories or more per day below what your body needs. Clinically, diets below 800 kilocalories per day are classified as very low-calorie diets, VLCDs. These are not designed for unsupervised use. They exist within structured medical programs, such as certain NHS pathways for type 2 diabetes remission, and they require professional oversight. So what actually happens when restriction goes too far? Research shows that severe calorie cutting can lead to muscle loss, nutritional deficiencies, hormonal disruption, and electrolyte imbalances. There's also an increased risk of gallstones, and in more serious cases, cardiac arrhythmias. There's also something called refeeding syndrome, a potentially dangerous shift in electrolytes that can occur when someone resumes normal eating after a period of severe restriction. It's one of the key reasons that very low-calorie approaches require medical supervision, not just during the restriction, but when coming off it too. For people managing diabetes with insulin or sulfonylureas, there's a particular concern. Significantly reducing calorie intake without a medication review can increase the risk of hypoglycemia. If you're on either of these medications, please do not adjust your doses yourself. Speak to your GP or diabetes team before making any significant dietary changes. It's also worth knowing that aggressive restriction without specialist oversight is not considered appropriate for pregnant or breastfeeding women, anyone under 18, people with a history of eating disorders, or those with significant underlying medical conditions. If you're concerned about your relationship with food, please speak to your GP or contact BEAT at beateatingdisorders.org.uk. What are the signs that a deficit might be too extreme? Things to watch for include persistent fatigue, dizziness, difficulty concentrating, feeling cold all the time, hair thinning, irregular periods, and a preoccupation with food that feels difficult to manage. These can be signs that your body isn't getting what it needs. Don't ignore them. If you're thinking about losing weight, it's worth having a conversation with your GP or a registered dietitian about what a realistic and appropriate deficit looks like for your specific situation, your health history, any medications you're taking, and your lifestyle. And if you're already following a restrictive plan and experiencing any of those symptoms, please contact your GP. For urgent concerns, NHS 111 is available around the clock. To recap, a moderate deficit of around 500 to 600 kilocalories per day is what NHS and NICE guidance recommends for most adults. Very low-calorie diets should only be used under medical supervision. And certain groups, including those on specific diabetes medications, pregnant women, under 18s, and people with eating disorders, should not attempt aggressive restriction without specialist support. Weight loss done safely is weight loss that lasts, and your GP or registered dietitian is the right person to help you find that balance. If you found this helpful, give it a like and subscribe to the Bolt Pharmacy channel for more medically informed health content. And if you have a question, drop it in the comments below.